right, well, let's take a look. Any specific symptoms at this point?
No, I think
in the game? Just maintenance?
Yeah, maintenance.
Okay. Just like with other my other patients in my human practice, obviously horses go through everyday aches and pains and stress over time. So he's on what we call our maintenance program. Basically, you know, there's really not a whole lot of correction we're going to be able to do for him, but we're just helping him do what we call palliative care, just make sure we get him feeling better, and so he can do as best he can. They use him how often? 3-4 days?
Oh, a lot.
A lot.
Yeah, he's
so,
like our most used.
He's one of the most used horses here, so if he goes down, there's going to be a lot of disappointed folks around here, so we want to make sure we keep him in good working order and good working condition so that there's no downtime. Okay. I've worked on him before. He had some problems with the lower back here as well too. So we're going to take a look, start with the pelvis. Good springiness in the joints here. Good. Okay. And this isn't eliciting a pain response like it has in the past, so that's a good thing that it's not flared up. But we still want to make sure we get all these bones back where they belong and get them moving. A little bit of a pain response, a little higher on the right side here, so we're going to take a look at that real quick. You can see over here, I'm pushing as hard as I can. His muscle's a little sore. Over here, no response whatsoever. But right in here, right at, this is L4. The pain response starts and it's affecting down in the hip and legs. These are the nerves that exit the spine. They feed into the reproductive organs, the bladder, the lower intestine as well too. Good. There we go. Remotion palpate, make sure the bone's moving like it should. A lot of times though, they may still have a pain response for a day or so if they're swelling or if the muscles are irritated, but it's not nearly as bad as it was just a second ago before I made the correction. Putting almost as much pressure as I can put on them, and it's not nearly as big as it was before. I was only putting about 2 or 3 pounds of pressure. So let's make sure this pelvis is good. Good. Got a little spot right here in the mid-back, which we don't typically see on a routine basis, so good. Don't get a whole lot of motion out of these joints here. They're what we call converging right here. All the spinous processes converge right here, so there's less motion. The ribs come in and attach as well too, so when we get a misalignment, it's usually very mild at that point. We're going to check the withers here. If he's used a lot, and the saddle is sitting on the horse's back like this, and they could get on the left side every time. Every time you know, we get on the left side, the saddle's attached here, it wraps around. It's yanking the spine this way, so but we always check the withers, and 9 times out of 10, one of the bones in the withers here is pointing to the left, which is where it shouldn't be. It should be straight up in the middle. That's just because of the tradition we use to get on the horse on the left side. We're going to work on this one right here. A little bit of a pull move. I like this pull move. It's a little easier for me as a doctor. Not as much stress on my bones or joints. Good. All right. Let's check his neck out here, see how he's doing. Okay, and he's got this first vertebra, the atlas, out quite a bit on this left side. I mean, I'm digging on it here, and he is not liking it one bit. He's been nice and calm the whole time we've been working on him until I get right up here. And usually that's why clients call me. They say, hey, my horse is getting head shy, he's not wanting to turn. Rodeo horses do this a lot. If a header, his rodeo horse doesn't want to turn left, then he's going to be out of money and his partner's going to be mad at him. So this is one of the things we check. Make sure he's able to turn his head like he should. And he is not happy about this. Okay, give me your head, buddy. He's not wanting to let me have his head so I can make the correction. He kind of knows something's going on up here. That's okay. He's just really reluctant for me to work on that bone there, so let's get him to calm down just a little bit here, buddy. Does he have any problems eating or not able to chew his food or anything?
No,
Okay.
he's one that stays up.
Okay. You're gonna make me do this the hard way, aren't you, buddy? He's okay. Good. There we go. Chew it out. Okay, I've still got one little more correction to be done in here. Let's see if he'll let me do this again. And he's pretty willing this time. Maybe. There we go. There we go. Chew it out.